Welcome to Maryland Medicine Frontline News. This week, how COVID-19 is affecting people with cancer and some unexpected and surprising observations concerning COVID-19 and HIV. Former flight attendant Mary Payne was diagnosed with an aggressive form of brain cancer at the height of the pandemic.
April 25th, I thought I was having a stroke. I had slurred speech and a droopy smile, so I went to the local hospital. And they said, no, you have a mass on your brain. So they sent me over to University of Maryland.
Surgery was performed by Dr. Graham Woodworth to be followed by chemotherapy and radiation treatments. Luckily, Mary could go to the Maryland Proton Treatment Center, which continued to carry out life-saving clinical trials when other centers did not.
I'm very grateful that I could continue with my treatment just because, again, the aggressive nature of it, it sounded like the sooner they attacked it, the better. I was very thankful John could come with me, my husband could come with me to the Proton Center.
As the COVID-19 pandemic took place, the University of Maryland had set out new guidelines in terms of which studies should remain open and which should not. And as a part of that process, myself and Dr. Bill Regine, who's our chair of our department, sat down and reviewed all of the clinical trials that we have open at our main medical center, the Proton Center, as well as across the University of Maryland Cancer Network. And we helped prioritize clinical trials that were deemed to provide a direct and critical patient benefit. And we helped maintain those trials open to help give patients access to those studies if that was appropriate.
The staff there, the technicians, off the charts, amazing. They made me feel comfortable and cared for, and so it was a very, very positive experience without a doubt.
With COVID-19 affecting so many aspects of patient care, all departments are adapting to provide the best possible care. At the Institute of Human Virology, the pandemic has temporarily changed the way comprehensive primary care and HIV services are provided by the THRIVE program,
which stands for Together, Healing, Reaching, Inspiring to Achieve Victory Over Illness and Embrace Life. We really tried to transition to telemedicine to keep people away as much as we could. And so everyone was really involved in that. We have our peer coaches reaching out to patients that don't have an appointment to make sure that they have the technological capabilities to do telemedicine, that they know how to open a Zoom link when it comes. So in general, the advice was the same as it was for anyone, but we did a lot to try to make sure that our patients particularly stayed safe during this.
Part of the IHV Center for Infectious Diseases, the THRIVE program is located at the University of Maryland Medical Center Midtown campus.
When this all first started, there was a lot of fear that COVID would have a worse effect on people living with HIV because of their suppressed immune systems. And we didn't know if people would become infected more frequently or if they would have these more severe outcomes that we saw. In terms of the evidence for COVID being worse than HIV or not, the evidence is still limited, but it really doesn't suggest that this virus is any more virulent or damaging in people living with HIV. And this is anecdotally what we've seen as well. It doesn't seem like they have a higher death rate than others. And the explanation is likely that our patients living with HIV, even if they have well-controlled HIV and they have a CD4 T cell count that is high enough to prevent opportunistic infections, they still have lifelong immune dysregulation. And a lot of the pathology that is seen in severe COVID in people in the ICU and in people dying is a markedly overactive immune system. And so we think at this point it's possible that having HIV or having other immune suppressive conditions might actually be protective.
Dr. Schmalzley says research is underway to better understand how COVID-19 affects people living with HIV.
We're very fortunate that we have had so many infectious disease specialists here at the University of Maryland School of Medicine. For example, we have the Institute of Human Virology that is dedicated to viral infections in particular, and for years has had a clinical arm called the Center for Infectious Diseases. And they are now using an approach where they're linking up social services, medical services, and of course, psychosocial support to these patients to ensure that one, their medications that they have been on continues but at the same time, the new therapies for post-COVID infection is being addressed. So again, it is good to have this type of service, the Center for Infectious Disease, available so patients can really avail themselves of this particular service that is so very valuable in our community.
You can stay up to date by visiting the coronavirus update page on the School of Medicine website. Until next week, I'm Larry Roberts for the University of Maryland School of Medicine.